What's up, Human Phys class? This is Mr. Yago going through section 9.3, what is the cardiac cycle. Up to this point, you have a pretty good understanding of the role of the circulatory system in the body, and now you have an in-depth look at the heart and its anatomy and physiology. So now we're going to look at the heart in a little bit more detail. We're going to move out of kind of the path of blood and into what a heartbeat is, how we measure a heartbeat, and also look at the electricity, because your heart does run on electricity. So what I have for you guys to write down here is basically what the cardiac cycle is. And we consider that to be one complete heartbeat. The contraction of a heart chamber is called a systole, and the relaxation of a chamber is called a diastole. You might have determined this as the systolic over diastolic, or maybe you've heard it in its quantitative value, which is your blood pressure. Healthy blood pressure should be around 120 over 80. Alright, so in this slide I have a look at what blood pressure is. And blood pressure can be defined as the force of blood against the walls of the artery. So as blood is pumped through the body, it essentially is going to push out on everything. That is simple fluid dynamics, which you learn about in physics. So once we understand blood pressure, we need to know that when we look at it in our bodies, there are two numbers, the systolic and the diastolic. The systolic is the pressure as the heart beats, so we would call that the heart contraction when it squeezes. And the diastolic pressure, which is as the heart relaxes between beats. This would be your lub-dub, doop-doop, doop-doop. Systolic over diastolic, okay? And there's a couple things that we use to determine it. This right here is a word that I'm always going to butcher, and I don't know why I can't say it. You can try sphygmomanometer and a stethoscope, and we're going to use these in class. These are kind of the old school method, although a lot of nurses use it today. You've probably used the electronic or digital one as you're waiting in line, maybe at a Walgreens or a Walmart, waiting for that old man to get out of the chair to give you a shot. But this is old school, and it still works. It's very difficult, actually, which I know you think you just pump it up and do it, but it is very difficult. So we're going to get an opportunity to try that, and you'll be able to look at these two numbers in a lot more greater detail. Now, this chart over here is a chart that deals with hypertension. Hypertension is a serious issue in the United States. As you can see, this area right here is in a darker red, and that is a problem. That means we have upwards of 38 to 39% of that 20 and older having hypertension, which is high blood pressure. Hyper means above, so it would be above the normal tension in your body. Now, it can be genetic. It can be passed, from generation to generation. But if you know anything about the South, and I'm not just ripping on the South, but there's a lot of not so healthy food. Maybe those of you that have been down there realize that they do enjoy their food. And it has a very high saturated fat content, a high cholesterol content, and a high salt content. Now, that's nothing to say about the other states. It's just that that's a higher prevalence there. Now, all those can lead to blocking up arteries. And if anyone knows about pressure, if you stick your finger in a hose or your thumb in the hose, while the water's moving through, it actually sprays it out at a higher pressure. So that's kind of the same concept, but that can be bad when we're dealing with the heart. So you can get a little bit of an idea of where hypertension is an issue. Heart actions, continued. The cusps or flaps of the bicuspid and tricuspid valves, which we've discussed before. Remember, your bicuspid can also be called your left atrioventricular AV valve, and your right can be considered the tricuspid. They're anchored to the ventricle walls. Here's your ventricle right here. Here's a ventricle. By fibrous cords called chordae tendineae. Very simple to remember. They call them cords because they really are kind of cords you maybe see on a guitar. And they call them tendinae because it is made out of the same dense connective tissue that we find in tendons. So it is a very strong material. And there's also what we call papillary muscles. So we all know that muscles contract things. We know that tendons are going to connect muscle to bone. But in this case, these tendinae are actually going to connect the valve to the ventricle. And essentially what their job is they're going to prevent valves from being pushed up into the atria during the ventricular systole. So during your systole, when the heart beats, it's going to squeeze blood up out of those ventricles. And to prevent any of that being pushed back into the atria here, which you can see right here, so as the blood goes that way, when you squeeze the heart, the blood's going to want to go through the path of least resistance. So if the least resistance is here, great, that's where we want it to go. But if there ever is an issue with these cords or with these muscles, we're going to have backflow, and that's going to really mess with your pressure. Anyone that's had valve issues in a heart is usually in kind of a serious situation because it can really mess with a lot of stuff. Give you arrhythmia. You'll find yourself maybe your heart having to pump harder to get the blood flowing, which can cause an enlarged heart, and it's definitely going to mess with the pressure. So you're going to have trouble getting nutrients and oxygen to your extremities. So that's a little bit about the moving parts of these valves. Remember that valves have one-way flow. So if blood goes through this way, when that blood tries to come back, these flaps will close. And what's going to help keep them closed and opening are these choroidae tendae and the papillary muscles. All right, here again is the image of that sphygmomanometer. Probably said it different again. But the average normal blood pressure for an adult is 120/80, as I mentioned. This number will vary, and feel free to paraphrase this. You don't really need to write all that down. Maybe you already wrote this down when I talked about it previously, but that systolic is usually the 120, the higher number as the heart beats. The lower number is the diastolic, which is going to be around 80 as the heart relaxes. And this device is going to be used to measure it. I also have some of these, which you can test out, and these are the electronic ones. They're kind of iffy. Sometimes they work well. Sometimes they don't. We did have a student, I believe, last year or 2 years ago, have a reading of like 60/15. That you should be dead. So I don't know how accurate these are. Sometimes it works, but this is usually kind of a fail-safe method. Tricky, but the sphygmomanometers work pretty well. All right, another thing that I want to look at is factors that affect blood pressure. Now, I mentioned some environmental things like your diet. That is definitely going to affect blood pressure. But let's take a look at some physiological things in your body. First thing I want to define for you is what we call cardiac output. And that's essentially what we would describe as your stroke volume. So every time the heart contracts, how much blood is getting moved out and how quickly is that happening. So we calculate that by how much blood moves out of the ventricle, and then obviously the heart rate, so how many times it beats. So if we take those two numbers and multiply them together, we get what we call our output, our stroke volume. Very similar to, I would say, like a revolution per minute in a car. As it relates to horsepower or maybe torque or foot-pounds of thrust. It's a rate, and it's basically just describing, how efficient is your heart? If your heart beats 60 times in a minute, is that enough to get, all the necessary blood moving through? Cardiac output will be ideal if you have a resting heart rate under 60. Basically what a doctor would say is that means that your body does not have to do that much work. It is very fit and it is very efficient. Blood volume. In an average adult, and this is going to probably speak more towards the males, but you should have 5 liters of blood. So if you think of what a 2-liter bottle of soda looks like, you should have 2.5 of those in your body, just to give you a little bit of an idea. Females, it can be less, usually probably about 4.5. Blood viscosity. The word viscosity is a scientific term that you maybe have discussed in maybe Science 9, maybe biology, maybe physics, but viscosity is defined as the resistance to flow. So if something has a high viscosity, I would describe that as honey. Honey has a very high viscosity, or its resistance to flow. So your blood viscosity would basically be speaking to how thick or thin blood is. High viscosity would be thick, low viscosity would be thin. Now you can probably imagine some things you can do to your blood to make it thick or thin. One of the greatest examples is the presence of alcohol. When you drink alcohol, it will actually thin out your blood, and that's going to make it a little more runny. Now that has its downfalls. It makes it easier to leak through the capillary beds. It also makes it easier when you get a cut to bleed out. So kind of think about how that plays a role. In terms of thickening up your blood, there can be a lot of things that do that. Obviously, the lack of water is definitely going to thick up your blood. So if you're dehydrated, your blood will actually be pretty clumpy, and that is a little bit of a problem. The last factor that can affect blood pressure is peripheral resistance, and that's the pressure against the walls of veins and arteries. So that's essentially going to be, I guess, how much give you have in your blood vessels. If they're hardened due to things like cholesterol and saturated fats, you're going to have more of a resistance. If you have very healthy blood vessels, they can kind of move a little bit. So I would compare this to like shock absorbers on a car. If you have good shock absorption, you have a very smooth ride. If you don't and you have a lot of peripheral resistance, it's rather bumpy. All right, now an ECG, an electrocardiogram, is something that is used to record the electrical events or changes during the cardiac cycle. There are three parts to it, and I want you to not only jot down this information here, but also I would put this picture in. Very simple. It's the classic heartbeat that you would see drawn out. This is definitely an old school electrocardiogram, which is on graph paper now. You can imagine these are all digital. But they're going to hook some electrodes up, and that is going to give you the amount of electricity that is occurring and being pushed over the whole entire heart. So the P wave, which is located right here, is the atrial contraction. Remember, to contract is for a muscle to contract. The depolarization of the atrial causes that contraction. This is your systole, or your systolic pressure. The depolarization of the ventricles, so both the right and left ventricles, are called the QRS complex. So first the atrials contract, then the ventricles contract, and then we have a period of relaxation. That would be the T wave, where we repolarize the ventricles. Notice that these terms that I'm using here are the same terms we discussed in the nervous system when talking about an action potential. Remember how we depolarize the sodium and repolarize the potassium? Same concept is occurring here. Now, a decent heart rate is going to be something around 60 to 70 beats per minute. Again, it could change a little bit. And those sounds that you're hearing of the PQRST complex are opening and closing of the valves during those contraction cycles. And then obviously the flow of blood into and out of the chambers causes some vibrations in the muscle, and that can be picked up as well too. So an ECG, an electrocardiogram, is looking at the electricity in the heart. So when you are listening to heart sounds, and you'll get an opportunity using a stethoscope, to do that. That's the instrument that we can use. You're listening for the lub-dub. And in class, I'll try and get an opportunity to play what a normal heart sounds like and what an irregular heartbeat sounds like. You can probably generate an idea of what a healthy heartbeat does sound like, but we'll have an opportunity to listen to people in the class and also give you some various things to listen to that are irregular. So let's talk a little bit about this electricity. As you can see here, we have the heart, and it's kind of a different viewpoint. We have a bunch of green kind of wires here. These are actually parts of the nervous system, and this is where the electricity is going to run through. And on the next slide, I'm going to go into a lot more greater detail, but I feel like these terms are going to help you a little bit. The SA node at the top here is considered the pacemaker. So it is going to keep the pace going, and you probably in your mind are thinking, well, yeah, I've heard of a pacemaker before. Those can be put in. Yes, that is going to fix the SA node. The AV node here kind of continues the signal. The bundle separates the charge, and the fibers spread the charge. All right, so this is the most important information. This is the conduction cycle. It's kind of the physiological concept of this unit. Remember, I always have a concept I want you guys to understand. And it's pretty straightforward. The step one is going to be the SA node firing, which is right here. Remember, we called that the pacemaker. And a lot of people are wondering, well, where does it get its electrical signals from? Well, it is essentially coming from the brain, but let's just focus on what's happening at the heart. So once the SA node fires an electrical signal, it's going to excite and spread through the atrial myocardium. Remember, the myocardium is that middle muscle, and it's going to start out in the atria. So not only is it going to hit your right atria, but it's also going to move across to your left atria. So that charge actually spreads out, as you can see here, from 1 to 2. Once everything's excited with electricity, the AV node fires. So it's almost like a chain reaction. And you don't want this to fire until that fires. So once the SA node fires and spreads, then the AV node will fire, and it is going to excite. You can see it goes right down the septum here, which is one of the anatomical structures we mentioned in 9.2. And it's going to spread down in what we call the AV bundle, the atrial ventricular bundle. And that is right here. It's a very main nerve, and as you can see, it's a large tube, and that'll break apart right here into 2 tubes, one going up to the right side of the heart, one going up to the left side of the heart. And then finally, the last piece of this is the Purkinje fibers, and they're essentially responsible for breaking apart the signal into all the various parts of the heart. Notice that they're going to come up here into the valves, into the parts of the upper portion of the ventricles, and essentially make sure that that signal gets all the way through and all of those muscles contract. Because remember, it requires electricity to contract a muscle. The heart's a muscle, and this is how electricity works its way into the cardiac cycle. Now, these last few slides, I'm going to look at some issues and some disorders in the cardiac cycle. One is called SADS, and that is sudden arrhythmia death syndrome. And arrhythmia is an irregular heartbeat. And what can happen is that irregular heartbeat can actually cause death. That's why they also call this sudden adult death syndrome. Routine ECG, which we learned about, screenings may help prevent these deaths in young people. But this is just kind of a random thing. It's kind of scary, but usually there are some telltale signs. You'll have some arrhythmias in the heart, which we're going to look at next. But this does affect many people and can be a genetic thing. It's not really necessarily an environmental thing. So let's look at some of these ECG irregularities. Tachy and Brady, as well as cardia, are all 3 terms that you should have put down for your prefixes and suffixes. Tachycardia, as you can see here in this little ECG printout, is an abnormally rapid beating heart. And it's defined as a resting heart rate over 100 beats per minute. That is a key thing to know. A resting heart rate. Those of you that are in a lot of athletics, especially high cardio, I would consider any type of sprinting, even basketball, football, track, things like that, golf, you would have some high, no, I'm just kidding. You would have very, very high heartbeats per minute. So this is a resting heartbeat of over 100. That's tachycardia. Now, Brady means usually slower. Sorry, Brady, you're slow. But bradycardia is a resting heart rate of under 60 beats per minute. So bradycardia isn't necessarily bad, but you should be somewhere around that number. And then an arrhythmia is an irregular heartbeat. So anytime you see the heartbeat slow up, get rapid, or deviate from the normal, as you can see here, we got a bum 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 boom bum 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 bum. That was just a made up noise, but you can see that there's definitely some irregularities in there. The height of the QRS complex, as well as the P wave, that's definitely an issue as well. So these are just some irregularities that we're looking at. So what can we do if we have irregularities? A very common machine, especially today with the increased rate of awareness for heart-related issues, especially in sports. We've probably heard a lot of stories of basketball players basically falling over, having heart attacks. It is pretty mandatory that we have AEDs. And if you look outside of our gymnasium, you should see a box like that. And there also is going to be one located in the office and in the health room. And I believe there's one down in the E-wing as well. But that is a defibrillator. And essentially what that does is that is a common treatment for basically life-threatening cardiac arrhythmia. An arrhythmia is basically a heart that's beating out of out of synchrony. So the device will essentially shock the heart and allow it to reset to a normal rhythm. So this can occur in a life-threatening situation, and this is also a treatment that is done to people who are essentially feeling fine but just have an irregular heartbeat that needs to be reset. So this whole unit discussed the processes of the cardiac cycle and essentially how the heart beats. Very important to take a second and look through your notes over the next couple days. We just had a quiz, but we'll be having a test in the next week if you take a look at your outline. Next up on your list of to-dos is section 9.3, the homework, online homework. And there's a little quiz there for you to kind of check what you have learned in this unit, or excuse me, in this section. If you have any other questions, please feel free to contact me. If I am not here, shoot me an email and I will do my best to get back to you. Other than that, that's all I got for 9.3. Yago, out.